East Riding of Yorkshire Clinical Commissioning Group, Engagement, Involvement and Communication Strategy, 2014 to 2019. Better care, more locally, within budget, through transformation. In April 2013, NHS clinical commissioning groups were put in charge of making health decisions and planning what services to buy. The East Riding of Yorkshire CCG started doing this on the 1st of April 2013. The CCG works over a very large area. Many people live in towns, and some live in the countryside. Health services for people in East Riding are run by Humber NHS Foundation Trust, Hull and East Yorkshire Hospitals NHS Trust, North Lincolnshire and Goole NHS Foundation Trust, and York Teaching Hospitals NHS Foundation Trust. The East Riding of Yorkshire CCG is made up of 37 local doctors' surgeries. Spends £350 million every year and is in charge of buying lots of health services for people in the East Riding. But the NHS has to save money, and the CCGs have the difficult job of saving money and making services better. It can be difficult for local health and social care services because over half of people live in hard-to-reach places, which are small and not near to other people. In 2012, there were about 336,000 people, and this will go up to 417,000 by 2033. A lot of these people are aged 65 years and over. That's 76,000 people, and this is going up. There are places where people find it hard and have very little money, like Bridlington, Goole and South East Holderness. Most people are British or Irish white, but there are lots of people coming to live here from other countries. For example, in Goole, where there are growing Eastern European communities from places like Poland. People like to retire in this area, which means people move away from friends and family who might help them as they get older. As people grow older, their health may get worse, and they may become less independent and find it hard to get about. Because people do not have friends and family around them to help, this can make things difficult for them. Aims. What we would like to do. To support our patients and the people in our area to be healthy and independent, whatever their age. To help make sure healthcare is equal across our area. To help children and young people be healthier and feel better about themselves. To make good use of the money we have and get value for money from all the services we pay for. To make sure we follow ideas and plans that are set for the country to make health services better. Engagement, involvement and communication. How people get involved. The Health and Social Care Act 2012 says what NHS commissioners, people who buy services, must do to make sure people get involved. Making sure the public are involved in checking things are working well. This might mean involving people who use services. Making sure people are involved in decisions about their care and treatment. Listening and acting on patient and carer feedback when we buy services. Working with patients, carers and the public when changing healthcare services and showing how we have involved people. Telling people about the patient and public voice we have used and the difference it has made. Telling people what local health watchers found out about health and care services in our area. For the CCG to meet these duties properly, we know that healthcare and well-being are not just the job of one organisation. So the CCG will look for ways to work together with the people who deliver and use services. Our vision. We know that the views, experiences, wants, needs, and the things that interest local people and organisations are really important to us. They will be used, together with local information, to help us change the way we buy services and do our work at all times. Ambition. What is most important to us? We want to make sure the way we involve people and talk to people is very open, planned, and creative. And is something we always remember in all our work. Because of this, we are always creating lots of accessible ways for people to get involved and have a say. Aims. By involving and communicating, we can make sure that patients, carers, staff, partners, and the community help us to understand how to improve healthcare services for local people. Get better services, have better experiences of healthcare, and have better health. Local people will be involved in decisions about how services are planned. Developed, delivered, and checked, as well as how they can be made better. Goals. We want to show that the care and services we buy are what local people need. This is called right care. We want to make sure that we offer the best service for local people by putting them at the centre of health and care services. We will do this by including people in decision-making, understanding what is needed by listening and learning, looking at what works well around the country to help us make decisions and make our services better. Asking people what they think of our services to help make things better. Helping people to manage their own health and well-being. Building and keeping good relationships with patients, carers, the public, and other organisations so that we are working together. Making sure people trust us and know we are good at what we do. Equality and diversity. The Equality Act 2010 says we must understand how our services make a difference to equality and diversity. The CCG thinks about the different needs of people in the region, diversity in the community, and the people we employ. The CCG understands that things like gender, race, disability, age, socioeconomics, where we live and the money we have, sexuality, and religion will impact on our life experiences. The CCG treats everyone as individuals. We will make sure that all our activities and services include everyone. Treat people equally. Welcome diversity. are accessible to anyone. Monitoring and evaluation. Checking our work. We will make sure the CCG board and other committees know about the work we do. We will look, check, and learn from our work, celebrating the things we are good at and always making things better. Review. Changing things if needed. The plan will be looked at and changed if needed every year.